Hello everyone, myself Geeta. Today I am going to discuss about HIV. HIV stands for Human Immunodeficiency Virus. HIV infects and destroys the cells of the immune system, making it hard to fight off other diseases. When HIV has severely weakened the immune system, it can lead to acquired immunodeficiency syndrome, a condition in which progressive failure of the immune system allows life-threatening opportunistic infections and cancers to thrive. HIV is a retrovirus that invades the T helper cells in the body of the host, characterized by fever, weight loss, and neuropathy. HIV is a sexually transmitted disease. HIV attacks and destroys the CD4 cells of the immune system. CD4 cells are a type of white blood cell that play a major role in protecting the body from infection. As we move to the structure of the HIV, the virus is composed of a capsid core which contains the genetic material that has been surrounded by a protein envelope. The protein envelope has many spikes of the glycoprotein. The outer part of the glycoprotein called GP120 is attached to the GP41, which is the inner part of the glycoprotein. The envelope of HIV also contains other proteins including HLA antigens. The genome of HIV contains 2 helices of RNA molecule in folded form. The enzyme reverse transcriptase is present, which is responsible for the conversion of the RNA from the DNA. Another enzyme present called integrase helps in the viral genome to incorporate in the host cell. As we move into the types, there are 2 types of HIV virus, HIV-1 and HIV-2. HIV-1 is present all over the world, and in India, more than 80% of the population is affected by it. As we move into the transmission, HIV is transmitted through the use of non-sterile syringes and tools, through pregnancy, breastfeeding, blood transfusion, organ transport, through unprotected sex. HIV is not transmitted through the food, drinks, and utensils, insect bites, through kiss, touch, cloths, towels, toilets, and showers. As we move into the HIV life cycle, the pathogenesis of the HIV virus affects the human beings. First, binding. HIV binds to the receptors of the surface of the CD4 cell with the help of glycoprotein GP120, as we discussed earlier. Fusion. The HIV envelope and the CD4 cell member fuse, which allows HIV to enter the CD4 cell. Then it undergoes reverse transcription. Inside the CD4 cell, HIV releases and uses reverse transcriptase to convert its genetic material, HIV RNA, into HIV DNA. The conversion allows HIV to enter the CD4 cell nucleus and combine with the cell's genetic material, and it undergo integration. Inside the CD4 cell nucleus, HIV releases integrase. HIV uses integrase to insert its viral DNA into the CD4 cell DNA, and then it undergoes replication. Once integrated into the CD4 cell DNA, HIV begins to use the machinery of the CD4 cell to make long chains of the HIV proteins. Then assembly. New HIV proteins and HIV RNA move to the surface of the cell and assemble into immature HIV. These are immature forms, and it undergoes budding. Newly formed immature HIV pushes itself out of the host CD4 cell. The new HIV releases protease enzyme. Protease enzyme acts to break long protein chains in the immature virus, creating the mature HIV. It is in infectious form. As we move into the clinical manifestations, in the primary HIV infection generally occurs between 2 and 2nd weeks after infection. Symptoms include fever, headache, sore throat, fatigue, body aches, weight loss, and swollen lymph nodes. Neurological symptoms of the peripheral neuropathy. Other symptoms are rash, mouth and gentle ulcers, diarrhea, nausea and vomiting, and thrush. Gastrointestinal symptoms such as vomiting and diarrhea may occur. The CD4 plus T cell count may drop very low during the early weeks. The initial illness can last several days or even weeks. The greatest spread of HIV occurs throughout the body early in the disease. In stage 1, it is asymptomatic, normal activity, but lymphadenopathy with fever or cold are seen. In the stage 2, weight loss is more than 10%. Dermatitis, fungal infection, respiratory tract infections are seen. In the latency period, after the initial infections comes the latency period or incubation period. Period lasts and median of about 10 years. The most common symptom in the latency period is lymphadenopathy or swollen lymph nodes. The lymph nodes of arms, neck, groin area are seen. In the stage 3, person spends more time on bed rest, that is less than half day. Weight loss is increased, that is 10 kg within a month is decreased weight. Diarrhea is seen more than 1 month and fever is more than 1 month. Weakness, oral candidiasis, severe bacterial infection, severe respiratory tract infection, pulmonary tuberculosis, vaginal candidiasis. In the stage 4, acquired immunodeficiency syndrome. Person spends more than half day on the bed and weight loss is increased. Defined in terms of, that is CD4 cell count below 200 cells per microliter, are the occurrence of the specific diseases in association with HIV infection. AIDS develops within 10 years after the HIV infection. Most common initial conditions are pneumocystis pneumonia, cachexia in the form of HIV wasting syndrome, and esophageal candidiasis and recurrent respiratory tract infections, and increased risk of developing various viral induced cancers, including Kaposi's sarcoma, Burkitt's lymphoma, primary central nervous system lymphoma, and cervical cancer. These are the opportunistic infections occurred along with the HIV. In the pulmonary, pneumocystis pneumonia caused by pneumocystis jirovecii, a yeast-like fungus, and tuberculosis occurs, and gastrointestinal esophagitis is an inflammation of the lining of the lower end of the esophagus. Unexplained chronic diarrhea is seen. In neurological condition, toxoplasmosis is a disease caused by single-cell parasite called Toxoplasma gondii. Demyelinating disease, in which the gradual destruction of the myelic sheath covering the axons of the nerve cells impairs the transmission of nerve impulses. In the tumors, Kaposi's sarcoma is the most common tumor in HIV-infected patients. Lymphoma, cervical cancer, hepatocellular carcinoma occurs. Coming to diagnosis, common diagnosis methods are ELISA testing, but has to be confirmed by polymerase chain reaction or nucleic acid testing or Western blot. How to protect yourself from the HIV or AIDS? Use safety precautions like condoms while having the sex. Get yourself tested regularly for sexually transmitted diseases. Practice safe sex. Limit the alcohol consumption. Use sterilized needles to avoid HIV transmission. Avoid the using drugs. Coming to the management of the HIV, antiretroviral agents are used. Nucleoside reverse transcriptase inhibitors, examples zidovudine, stavudine, lamivudine, didenosine, tenofovir DF, tenofovir AF, etc. are used. Non-nucleoside reverse transcriptase inhibitors are nevirapine, delavirdine, doravirine, etravirine, etc. are used. NNRTI's mechanism is block the conversion of viral RNA to viral DNA by inhibiting the reverse transcriptase. Protease inhibitors are ritonavir, indinavir, saquinavir, aprinavir are used. Mechanism of action is inhibit the cleavage of polyprotein into functional proteins, thus block new HIV becoming the mature HIV. Fusion inhibitors are fusion, efuvirtide. Fusion inhibitors block HIV envelope from fusing with CD4 cell membrane. Integrase inhibitors such as raltegravir, dolutegravir. Integrase inhibitors block insertion of HIV DNA into CD4 cell DNA. Maturation inhibitors are beviramat. Thank you for watching my YouTube video. Please like, share, subscribe. Thank you.